Hope everyone's having a good weekend. Welcome to another 21st briefing. Big calendar this week. And most of what we're talking today, just a reminder, most of what we're talking about today isn't law. A lot of it's still in committee, still being amended, still being negotiated. And this is the time to reach out to representatives and ask for things to get changed, oppose, support, maybe even ask questions, seek to understand the bill a little bit more. The calendar for June 15th through the 19th shows most of the stuff that's going down is going to happen on Monday. And a bunch of assembly committees are going to dig into education, health, agriculture, oversight, state and local government. And Thursday, the 18th, is mostly about assembly and senate sessions. When I looked, there wasn't an official board list posted yet. Friday the 19th is Juneteenth, official state holiday, so nothing going on there. So I treat Monday as the big committee day. Keep an eye on Thursday for anything that's last minute. Remember, the budget deadline at the end of June is the elephant in the room. As we get closer to that deadline, bills can stall, jump out of the bushes, get rewritten, get folded into bigger sort of discussions. So this is just a starting point. So let's get into it. Assembly education is first up. And the bill, or the first bill that we're going to talk about, is A3881. That deals with school aid, district budgets, and the New Jersey Education Funding Portal. And this would change parts of the school funding process, including how preliminary state aid notices and budgets are handled. It would create a funding portal to centralize school funding information. The upside, better transparency. We could follow changes to aid, budget impacts, school funding decisions a lot more easily instead of having to dig through miles and miles of PDFs. I would love to see something like this for the ACFRs, which is the audit document, which is the true record of what a district spends. Because right now, those documents are PDF. A lot of districts upload them as images. So having them as something more usable, like an Excel export or a CSV export, would be great. So the hope is that the portal is actually going to give people real information. We have, as a state, I think, been doing a better job. I've been seeing more and more dashboards pop up. The hope is that this follows that path and gives people a way to actually track the dollars. Next up is 82042 and S1340 Ramadan opt-out bill. And that connects to physical education and sports for kids who observe Ramadan. And, Ramadan's a tough deal. Folks are fasting, you get tired. So physical activity could be kind of a real issue and just a genuine accommodation for a need. And it gives districts a statewide rule instead of having to try to figure it out on their own. Next is A2746 and S2962 military seniority credit for school support staff. So on the face of this seems like a real no-brainer. You give support professionals in education credit to seniority for their military service, and so I guess the logic is they've spent some time serving in the military, and this is a way of making up for that time if they would have been employed. And it could include non-teaching staff, aides, bus drivers, cafeteria workers. And so this would be a good bill for veterans. It incentivizes, school employment, treats military service in much the same way the private sector might. I think even civil service jobs kind of have some type of bump up for military service, but this connects specifically to seniority. So the barrier to this might be what the unions are going to think, because this can affect things like layoffs, assignments, bumping rights. I mean, those are big deals in the in the union world. I guess I'm guessing that unions are going to want a little bit of clarity on that. So while it's pro-veteran, it's also a labor bill. Next up is A5085 and S4260, the non-public school nursing pilot. And basically, this creates a county consortium of non-public schools that sort of get together and set up nursing services. And it makes it a little bit easier, a little bit more organized than every school out for themselves trying to do that. I don't know whether public money is involved in this or not, but anytime public dollars go to non-public schools, it turns into a little bit of the debate. Like, who's going to control this? Who hires the nurses? What oversight exists? Is this temporary? Is it permanent? We talked about something similar. Like we talked about this last week, I think. And then there was another bill that kind of tried to do the same thing for security or police. Not the same thing, but something similar. That's the one I think I'd plant a flag on in opposing. I could definitely understand health services for kids. I don't know why we would want to replicate bad ideas in public schools and encourage that in private schools. Moving on, A5167 and S170, state suggested spring break dates. This is discretionary. So basically, the commissioner would recommend spring break dates. Districts don't have to follow it. They would just get a nudge or a push. Hey, why don't you consider or using this week? And I guess sort of a top down or universal schedule would help families, employers, childcare providers, regionally, lining things up. Moving to Assembly Health, there's a sports medicine hearing. It's not a bill. It's going to connect to sports medicine issues, students and professional athletes, which I think means lawmakers are probably in sort of information gathering mode for a future bill. Maybe legislation around student athlete safety, concussions, return to play rules, athletic trainer requirements. Goal sounds good. Question is, does this turn into a mandate that's attached to money, and who's going to pay for it if it is? Assembly Health Infrastructure Committee has a hearing on whether New Jersey should use a statewide preferred drug list and pharmacy benefit manager for state-run health insurance plans or programs. This makes sense if you think about, if you've been following municipal budgets and district budgets this year, health plans are blowing up big time in terms of cost. This is a way of, I guess, it could be one way of bringing down costs. If the state pools its buying power, maybe we get better prices, more efficiency. The concern I think people are going to have is feeling as if they're going to be boxed in. Let's just say that maybe their medication isn't on the list and they might have to take generic. A lot of folks might have an issue with that as an example. So, that's something to watch for, but costs have to be controlled somewhere. This could be one way of doing that. A5222, interesting bill, involuntary commitment bill. And I want to be precise about this one. This doesn't simply create a brand new, longer hold period. It extends some temporary provisions connected to involuntary commitments by about 8 months. And these provisions are kind of tied to where someone is involuntary committed and facilities are struggling with legal or placement issues that are acting as barriers after the initial crisis. So folks who support this bill, I imagine, are going to say that this is needed, particularly when we're talking about system bottlenecks and how they connect to safety for the individual and public safety. But involuntary commitment is one of the most serious and concerning powers the state has. It's kind of like a necessary evil. And so we really need to ask questions about what exactly is being extended, how long, what are the conditions, what are the safeguards to protect people's rights. Obviously, I'm automatically skeptical of anything like this. I could definitely understand already in my mind the sort of argument for it, but I also understand that most psychiatric emergencies, most are short-term. A5223 is separate, and that has to do with a different aspect of this, which is bed status flexibility in psychiatric units. And this just creates a voluntary pilot program and would allow facilities to temporarily adjust their bed status between different units, like adult, child, adolescent. And the goal there is flexibility, where if you have an excess in one, but underutilization in another, you can kind of swap out numbers temporarily to meet those needs instead of being locked into sort of a rigid quota for each. I don't think quota is the right word, but something to that effect. Going to Assembly Oversight Reform and Federal Relations, reviewing the selection of Montclair State University to take over the management of New Jersey's public television stations starting on July 1st. WNET is right now the current operator. I like this idea. University could bring in resources, educational program, could bring some stability to this. Montclair State already has the Center for Cooperative Media, the News Commons, so they've kind of made their way into this stuff. They seem like Actually, it seems like a really great idea to have them give this a shot. Obviously, public's still entitled to ask questions, and there are important questions. Who's going to protect editorial independence? How transparent is the funding going to be? Will the programming remain free from political or institutional influence or pressure? So, I mean, I think those are basic questions. A3946 EV fire training for first responders. I guess electric vehicle, I don't know very much about electric vehicles, but from the little I do know, I guess the batteries blowing up and how they burn up is probably or is very different than how a car or a regular truck might burn up. And this is just simply a way of training folks who are responsible for putting this out, best practices on that. Good policy idea. The question always is who funds it? That's a big one. A2550, another really good idea, in my opinion, on its face. Details matter, but on its face, this seems like a good idea. Extends health coverage for disabled adult children or dependents. And this basically allows adult dependents with disabilities to stay on their health benefits past 26. And, for a lot of families who are paying the financial cost, doing their best, this would really meet a need for them. Disabilities we know can present with challenges in things like employment, increased healthcare costs. And so this would alleviate some of that burden. It would create some relief in an area that is often the cause for things like bankruptcy, especially for working families. I'm sure insurers or employers are going to want clear rules on that, what qualifies, what disabilities qualify, what documentation is required. A5013, alcohol-infused ice cream and frozen desserts. And I guess this, well, it will allow, I guess, the production and sale of ice cream and frozen desserts made with some alcohol in it or certain alcoholic beverages in it. I'm sure there are going to be people that are very excited about this. I guess you have to be really, really clear about labeling. Uh, make sure the ingredients are on there, age stuff on there. I don't know what this might turn into, what it might turn Saturday nights in front of the ice cream shop into. Definitely a novelty idea. Sure, people are going to be happy and excited about it. There are probably some downsides if we're not careful. A2100 is the co-op purchasing bill. This would allow educational research and service corporations to act as lead agencies, contracting units for buying goods and services. We have this already in municipal government. And the idea is to sort of streamline procurement and save money by buying bulk. The concern always is with stuff like this. When we talk about these bulk procurement things, transparency gets cut down big time. People don't always have a clear idea as to how vendors are selected for this stuff, what items were bought, whether there's real oversight. Don't love this bill. They did improve it with an amendment that excluded public works or big construction projects. So that's a relief because those two in New Jersey are already problematic and questionable areas for local governments. At least those were excluded from this bill. A4881 and S4296, the Power New Jersey Act. You will not find a bigger fan of nuclear energy than me. This would set up an advanced nuclear energy procurement program with the BPU, creates a process for advanced nuclear projects to be looked at, approved, and includes projects involving electricity sales to co-located users through purchase agreements. Carbon-free, forever energy. That's reliable. So let's get on board with making nuclear as easy as possible in New Jersey. A4959, the Affordable Power Purchase Agreements Extension Act. So, public entity power purchase agreements tied to energy conservation and renewable energy. That's what this is about. On one hand, this can help with having public entities bring renewable energy upgrades online without a massive amount of upfront investment. On the other hand, long-term deals can go south, especially when the cost savings assumptions fall through or fail. So we really have to know, A, can we get out of these deals if they fall apart? Who's going to end up paying for this stuff if the assumptions don't pan out? Moving to assembly, agriculture, and natural resources. A158, the farming mentoring or the farmer mentoring program, really like this idea, would require the Department of Education to develop and implement a farmer mentoring program, just a way of passing on knowledge from the old timers to the new timers in farming. New Jersey has a huge farming tradition. This can help sort of continue that tradition, vital to the economy and our culture, I think, as a state. A1517 Native Seed Commission basically establishes that, a native seed commission to develop a plan to increase the production of native seeds. Makes sense for things like pollination, restoration projects, stormwater management, even. And so native plants are supposed to be here as better suited for our climate or our environment. A3094 pollinator friendly plant label would basically just slap a label on stuff for certain plants. So people can choose the kinds of things that help bees and butterflies and I don't know, any other bug that pollinates. A4237 is the Large Animal Veterinarian Loan Repayment or Redemption Program, excuse me. And this would create a loan repayment program totaling about 200,000 to bring veterinarians back into large animal work. A lot of money's made in that small stuff with the cats and the dogs and the lizards. And so it looks like this speaks to a need in terms of things like horses and cows. Are pigs considered large animals? I don't know. But I don't know how far 200,000 would go, but I guess it's a starting point. I might have missed a few that I didn't think was important, and that doesn't mean they're not important. But let's cover some bills that aren't on the calendar because there are some firecrackers, and we're going to start with S2260 and A2218, the reproductive and transgender health care protection. So some of this bill is good. Some of this bill basically says, hey, listen, if you're coming to New Jersey for healthcare services, we're going to limit our cooperation with out-of-state or federals in investigating healthcare that you utilize in the state that's lawful. And we're going to do our best to restrict subpoenas and search warrants and wiretaps connected to certain proceedings. So this is a way of sort of protecting that. And listen, if you're a states' right person, this idea of punishing one person in a state for engaging in an activity that's legal in that state should bother you. I don't claim a Republican or Democrat mantle. I want to be very clear. But if you're like a conservative states' rights person, this should actually make a lot of sense. The biggest concern, though, and despite it making so much sense, I kind of feel like it shouldn't pass. There's real big First Amendment concerns with this. There's language around intimidation, coercion, reputational harm, civil liability that can definitely like scope creep into what is generally protected speech. It could affect journalism, online speech. So there's a lot of people that support this, but this First Amendment stuff that's in there is acting as a real barrier. You know, free societies, people are just going to say things you don't agree with, and they may even hurt your feelings. We shouldn't do that, and we try not to do that, but that's the whole point of the First Amendment. And once you start limiting speech on what folks can criticize and say, obviously outside of things like slander and stuff like that, you're going down a pretty slippery slope. Honestly, this probably will be more of a problem in terms of litigation costs. I could see this easily getting challenged, working its way up to the courts, and that provision being overturned. Now, the bill was amended to make things a little bit better. Let me look at my notes. They got rid of things like entrance, gathering, impede, social media. Some of those terms were removed. Next one is Spark. That's a big one. We talked about this one like about 2 months ago. School-based partnerships for access and resilience for kids program. And it would require public schools, charter schools, Renaissance schools to establish a comprehensive mental health support and partnership program for kids or students that would be housed in DCF, the Department of Children and Families, connecting K-12 kids with behavioral health needs to community-based services. And Look, it's an important thing. We know some kids are really struggling and that schools can get overwhelmed. The schools really aren't the best place for this kind of work to happen anyway. We really don't want schools involved in this, if we're going to be honest. But this is a major systems bill. And there are questions about data tracking, reporting requirement. What are the school responsibilities? It's also another system, another transition for families. And I think we just had a recent one. So mixed feelings about it. Maybe the best path isn't going right into a new approach wholesale, but maybe doing things gradually and piecemeal. We also have been talking about the New Jersey Kids Code Act, which creates age appropriate design code, and also and that's S3413 A4015, and then related to that is S3412 and A4013 social media mental health bill. Those are bills that are also moving, and we kind of talked about this last week. It's about making sure that child safety is ensured online, that social media platforms take actions that are protective of mental health. And then there's S1826 that connects to online age verification for sexually explicit material. So that's a slew of technology bills aimed at protecting kids and their privacy and their well-being. The concern there as well is how laborious or burdensome is this going to be to implement? Are there free speech concerns? I think there's a way of doing it where that isn't an issue. At least the free speech stuff. I don't know so much about the technology piece of it. And finally, S3744 and A4677 local news advertising set aside. This could help local outlets. New Jersey has massive major news deserts. Even when you have, and so those also include communities that might actually have a long-standing news outlet that is part of a franchise for profit that tends to get its money from the same entities it's supposed to hold accountable: school districts, municipal governments. So my hope is that this goes to mainly independent, nonprofit, or if it's for profit, non-chain affiliated, non-conglomerate news outlets that, we try to breed healthy, independent news organizations in let the municipal government and school district have their sort of marketing magazines, but give residents a viable news source. And I think that's it for the agenda. So there's a list of the bills on the bottom of this, as well as there might be some notes if I notice in the transcript that I made a mistake. I really don't feel like re-recording this again. I'll talk to you later. Have a great week.